My name is Dee Dorsey, and I am a board member and a leader with Addams Senior Caucus in Chicago. We have over 500 members and fight for a world where seniors can live in age and dignity.
And I'm Bill Bianchi, also a board member and leader with the Jane Addams Senior Caucus.
I am an 80-year-old woman with a disease that has no cure and no medicine to stop it. About 20 years ago, when I had to retire from my job, my employer offered me a Medicare Advantage plan. I was nervous about the plan, but not knowing what else I could do, I signed up. Over the years, the co-payments have gone up, the deductions have gone up, and the cost of medicine has gone up. What seemed like a simple decision at the time meant that my pocketbook was hit harder every year. I know firsthand how inserting a profit-driven middleman in seniors' health care can hurt us. That's why we need to fight reach. Because a middleman does nothing for seniors' health care. I want to protect traditional Medicare for the millions of seniors who had a chance to choose it. And I want to expand it to everyone in the form of Medicare for all. Medicare for all means no co-payments and no drug costs for seniors, and would include hearing, dental, and vision care. I am dedicated to fighting for Medicare for all because I don't want to see any other seniors or anyone else be forced into the same position, having to deal with a profit-driven middleman in our health care.
Hi, I'm Bill Bianchi, also a board member and leader with Jane Addams Senior Caucus. I'm 78 years old. Last fall, on a lakefront walk, I began having symptoms of heart problems, plus nausea and vomiting. I thought, oh, COVID. The symptoms got worse, so my friends called an ambulance. I was taken to Northwestern Hospital emergency room, treated there for 24 hours, and then admitted to the hospital where I remained for a whole week. They had discovered a blood infection that needed to be treated immediately. Because I was on traditional Medicare, there were no provider networks to worry about. I was treated at one of Chicago's top-rated hospitals and by a bunch of top-rated specialists. Traditional Medicare covered all of the bills from the hospital and the specialists. It was $85,000 in total, but no questions or rigmarole. I paid only a deductible of $1,400, and now the infection is gone. I was able to make the choice to be on traditional Medicare, and I don't want to be moved to REACH. Seniors are angry and very concerned of what we are hearing about the REACH program. Dee and I have talked to some of our fellow Jane Addams Senior Caucus members, and people are terrified of being transferred without their will or consent to a third-party middleman that is allowed to keep as profit what they don't spend on our care. We know that means that Wall Street investors will be involved in our care, and they are going to be more worried about their bottom lines than they are about our well-being. So let's do everything we can to preserve traditional Medicare, and the best solution would be Medicare for all. No networks, no deductibles, just health care.